The procedure requires at least one assistant, but ideally two. Use adequate analgesia. Equipment and material. Stockinette, 10 cm web rule to protect the arm, 15 cm plaster of Paris, collar and cuff, cable ties, and cold water crepe bandages and tape. Have the patient sitting with their feet on the ground. They lean forward slightly and towards the injured side with the arm hanging. The assistant supports the limb and maintains the position while the proceduralist applies the plaster. The shoulder should be in slight abduction and internal rotation. The elbow 90 degrees, and the forearm can be neutral pronation or supination. For the cast, estimate the plaster length by measuring against the patient. Use 12 layers, from just proximal to the acromioclavicular joint to 5 cm below the axilla. Cut a large hole centrally through one end of the plaster, 5 cm from the edge. Thread the collar and cuff through the dry plaster and secure with the cable tie, or tape, which works just as well. Cut 15 cm into one end of the stockinette, allowing coverage of the shoulder and the AC joint. Apply the stockinette to the arm beyond the margins of where the plaster will be, allowing for folding back of the edge. Apply 2 to 3 layers of the padding or the web rule beyond plaster margins, ensuring adequate cover over the AC joint. Ensure that all bony prominences are well padded with an overlap of 25 to 50% and smooth out any creasing for comfort and skin protection. Submerge the pre-prepared back slab in water until bubbling stops. Keep most of the collar and cuff material dry. Squeeze out excess water. Apply, starting with the collar and cuff end, over the AC joint, along the lateral humerus, under the elbow to the axilla. Turn back the padding around the distal and proximal margins of the plaster of Paris, and this keeps it in place. Your assistant is very helpful in this situation. Moulding is essential to keep the plaster of Paris in place and to provide adequate splinting. Apply the crepe bandage firmly over the slab and fasten with tape. Gently mould the plaster of Paris to the patient anatomy, the AC joint particularly, maintaining position until hardened. Consider moulding the plaster of Paris at the fracture site to achieve reduction. Bring the collar and cuff around the neck and secure around the wrist with the Velcro attachment. Adjust appropriately for the patient with the Velcro to ensure a comfortable and neutral position.
So a couple of things to note for the hanging U slab. We recognise that this is a closed circuit, but in our experience what we've found is that a closed circuit is often more comfortable for the patient, and the plaster tends to last longer. It's less likely to fall off and the patient is less likely to come back into our ED. The role of the assistant is critical in this particular plaster. You need at least one, sometimes even two people to help. These are very painful injuries. The arm is often very mobile initially. So the assistant's role is to not just support the arm from a pain control perspective, but also to make sure that there is enough traction and that the arm is straight and the fracture is in a reduced position for when the procedure puts the plaster on. You'll find that you often need between 10 to 12 layers to get enough weight on that plaster to allow for enough traction at that fracture site.